Most hockey players with an anterior pelvic tilt or excessive lower back arching don't realize that there are two main muscle groups that matter the most. They are the hamstrings and the internal obliques, and here's why. When the pelvis is moving forwards like this, it creates an imbalance between the trunk, the pelvis, and the hips. For hockey players, this shows up as lower back tightness. The fronts of your thighs getting really tight, or difficulty staying comfortable in a lower stance. The hamstrings attach to the lower portion of the pelvis and down near the knee. When the pelvis goes forwards, the hamstrings start losing their shape and stretch and get elongated. The same things happen for the internal oblique muscles. They attach to the lower ribs in the top of the pelvis. The pelvis tips forwards, the ribs will flare upwards, causing these attachment sites to pull apart. To bring the pelvis back to where it needs to be in a neutral position, we need to recruit both of these muscle groups. Here's an exercise to do just that. All you need for this exercise is a chair and a band. Place your heels on the chair while having your hips underneath your knees and your knees parallel to your feet. With the band, you're going to reach it around your upper back and you're going to place your arms up towards the ceiling with about a 5-degree elbow bend. The band helps engage your internal obliques. Having your chin fully relaxed, facing the ceiling. As you're pushing up with your arms, the tendency is to lift up your head. Try to have your neck and your head fully relaxed. Push your heels against the chair and feel your hamstrings activate. Now slightly lift up your pelvis about 10 centimeters off the ground. We're not going for a hip bridge, we're just making sure the pelvis is slightly elevated while maintaining your lower back against the floor. Now you have your hamstrings and your shoulders both engaged. With your breath, you're going to exhale for 5 to 10 seconds, making sure that you're stacking your ribs over top of your pelvis. Near the end of the exhale, you should feel your internal obliques activate even more so. Now close your mouth and inhale through your nose, expanding your stomach, which will then use your diaphragm. We're going to do 2 sets of 8 to 10 repetitions of this exercise. This will help restore a more neutral pelvis.